information. Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Your daughter's on?
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
It's light, we'll be on what's on my mind. Nothing short of unbelievable.
These dreams can't compare to what I would see. Rivers flowing underneath, but with prayer it's reachable. God, it's so beautiful and hold the shine and silvering gold. I'll never pass my greatest chance to be free from this world.
Angels at the gates,
welcome us with praise.
Enter I give salam.
This greatest land Allah's gift to us,
filled with precious life,
gardens of paradise.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Al Ansar 90.4 and 105.6 FM. I'm Shubnum Ismail on the PMB Pulse show. Alhamdulillah, all praise belongs to Allah, the most merciful and the most compassionate, who has blessed us with health and the ability to seek knowledge. May peace and blessings be upon our beloved Prophet Muhammad sallallahu alaihi wasallam, his family, companions, and all those who follow the straight path, inshallah. Today we are diving into a crucial conversation about reproductive health and pregnancy. So join me as we explore the latest insights, break down myths, and provide you with valuable information to take charge of your health. Whether you are planning for a family or expecting or just curious about reproductive wellness, this show is for you. So let's get started. Today's episode is very special, featuring not one, but two esteemed guests in the field of gynecology. Joining us today is Dr. Thabo Liphapang, a renowned obstetrician and gynecologist based at St. Anne's Netcare Hospital. Born in Alice, Eastern Cape, Dr. Liphapang's impressive educational background includes a BSc degree from UKZN, MBCHB from Walter Sisulu University, and a fellowship from the College of Medicine of South Africa. He's also completed a Master's of Medicine in ONG from UKZN and holds certificates in cosmetic gynecology and gynecological endoscopic surgical education and assessment. Doctor's expertise lies in minimal invasive surgery and aesthetic gynecology, and he's here to share his insights on reproductive health and pregnancy. Welcome, Doctor.
Thank you very much. I would like to pass my greetings to all the listeners and even the people that are streamlining live. And it's really an honor for me to be part of this very, very much important topics that we are going to explore, and also, the Midlands, Devon, and South African and large the viewers. And I would like to welcome everyone. Say that also to say I'm very much honored to be part of this this program today. Thank you.
Fantastic. And our next guest, with 19 years of medical experience, Nadia Syed is a maternity unit manager also at St. Anne's. She and how are you doing, Nadia? And it's great to have you on the Pulse Show.
Assalamu alaikum wa rahmatullahi wa barakatuh to our dear listeners on Radio Al Ansar. Firstly, I want to start off by saying Jazakallah Shabnam Ismail. This show, starting off with the name, the PMB Pulse, I must hand it to you. Wow, what a brilliant choice, because it's a show that I can see that speaks to the heart of the listeners and directly because it is their pulse. It's such an honor to be here this morning to share the studio with Dr. Liphapang and yourself. And I'm hoping that at the end of the show, we would educate the nation.
Fantastic. And Jazakallah for those warm sentiments. So, listeners, let's get ready for a really dynamic conversation. So, Dr. Liphapang, can you tell us what made you choose a career in gynecology?
Uh, to be honest, gynecology, I always say that gynecology did choose me. Initially, I wanted to be a physician while I was in school. Post that, then I changed my mind while I was doing internship. I wanted to be a pediatrician. But when I did the ComServe, that's when now they said to me, no, because we are short in gynae, can you please assist us for about 6 months? Then after 6 months, we're going to move over and do pediatrics, rotating pediatrics as a medical officer. Subsequently, and then there was this specialist that I used to work with. He was from the DRC, Dr. Pentwala. Then when the 6 months, after 6 months, then he came to me and said, no, you cannot go and hold those little babies. So you are good with this. So you must stay here. Then I stayed there, and he taught me a lot of work. And after about 2 years, that's when now he said, now you are ready. Go back to school now and do gynae. All in all, I'm in gynae by default. But I actually developed that love about it, the passion with gynae, helping the mothers happy, that's what makes one.
Absolutely. We have to actually choose our career paths of what we are passionate about. So, Doctor, can you tell us what lifestyle factors impact fertility the most?
Yeah. There's just a couple of things, but the most important ones would be the diet, because one needs to have a balanced diet, because if one is malnutritioned, so it means that there is some hormonal factors whereby there would be irregular periods and also other health issues. The same if one is obese, there could also be unovulated cycles, and then amongst males there would be that low sperm quality, and so diet is one of the things that is quite important, and also the exercise. Then one need to do, if one is doing these extreme exercises, there can be issues in terms of balance, in terms of the hormones, and also the sperm count, low sperm count, and also some other people, they would actually maybe inject some steroids, which actually have also a negative impact in terms of the reproductive health. And alcohol and substances, that's when now you look at excessive alcohol, will also have issues. Smoking, excessive smoking will have issues. And also you also look at the STIs, which actually I feel that is the one part that is very, very important also. Because now with the STIs, other people will have STIs where there is also the damage of the upper genital tract. Then we've seen a lot of patients coming through find that they've got hydrosalpinx, which means that they will have, because of the infection, they end up having water actually damaging the tubes. Then the moment you go in there, the tubes are no longer patent because now they are full of water. So that's the inflammation. Therefore, we'll have the water seeping in there and then eventually damaging the tube. And then the tube becomes irreversible. The same comes with the sperm count. You find that most patients, they come through, then you do semen analysis, find that there is leukocytes there, so which means that infection can also lead to low sperm count. So those are the main things. Environmental factors can also play a role, whereby where one works, with all those guys, the old people, the trucks whereby they do driving, and old trucks whereby the engine is just yes, engine, all that heat on the scrotum, it can actually also lead to the because the low sperm count and yeah. So sleep pattern, that's one thing also. We need to sleep enough, have enough sleep, enough rest. So those are, in a nutshell, those are the main things that affect reproductive health.
I hope listeners, you are taking valuable information. And doctor, at what age should women start having regular gynae checkups?
This part we actually divide it 13 to 15 years of age, although there won't be any pelvic examination, just for them to come just to learn, because now on average that's when now the age whereby people start going into their periods, then that's when now we teach them about reproductive health, and then that is about maybe 20 to 29. That's when now they've got to come and do regular checkups, even from 30 to 65. In most cases, they will exit the program at about the age of 65, but it's quite important. And then now, in terms of the intervals, that's when now it differs that what one is coming for. For instance, between the ages of maybe 21 to 30, they can do pap smears, they can do regular pelvic exercises, contraceptive advice, general reproductive health. Then after the age of 35, the same. But then now, from the ages maybe 40, 45 and above, that's when now we can start now looking also into those things like menopause, the signs and everything. But and then now, from the age of 21, that's when now mostly we have got to have a look at pap smears. Other people will say you do annual pap smears, but then in essence, the pap smears, if they are normal, you can do them every 3 years. But then now, with the guidelines now including the HPV, if the HPV is negative, therefore the pap smears can abnormal pap smear is advisable to do the pap smears on an annual basis. Because now if one takes longer, I mean, we have seen patients coming through at the age of 25 with maybe stage 2, stage 3 cervical cancer. The main issue now that we are facing is because of the HIV. So now that thing whereby we're saying that, because in the olden days they were saying that we just have to start pap smear at the age of 30, but that has changed because now we have seen a lot of people 23, 25 years coming through with cervical cancer.
And doc, what are the key nutrients for a healthy pregnancy?
The folic acid, in the clinics they give folic acid. The folic acid is very important in terms of development of the DNA, the DNA synthesis, and also to prevent things like neural tube defect, the bone. We've got vitamin B6, also development of the CNS, the brain, and also vitamin D, omega-3 fatty acids, because now what makes things easy now is because now we've got these prenatal supplements. So the prenatal supplements, when you look there, you'll find that maybe I'm not going to promote any company, so I'm not going to say the specific drugs, or let's say the vitamins, but all of them, when you look on the side, there will be a list there. You'll find that there is omega-3 fatty acids, there is folic acid, there is folate, there is vitamin D, there is calcium. So everything you can just get easily now in pill. But as you have seen, the patients that are actually going to the public sector, they'll have a folic acid, they'll tell you that we have got this pill that we put into water. Okay. So that is calcium. So it's quite important because now it's both for the mother and also for the baby. For the baby development, it's quite important that we have got such nutrients.
And Nadia, you've got a neonatal ICU at your facility. Would you say that the diet impacts the premature baby, and do you see them at the facility?
Definitely. 100% Shabnam. The diet really impacts the quality of the breast milk that the mother produces for us. And remember, as a premature baby in the neonatal ICU, we are so dependent on that breast milk that you can provide us for that baby. And we want that baby to thrive, we want the baby to grow. So, whatever the mom eats will greatly affect the quality of her colostrum. Number one, that's the first milk that we want to give the baby, which provides immense gut health for that child and increases its resistance against diseases and bacteria, and it's the most important is liquid gold for that neonate. So what the mom eats plays a huge important role on the quality, and at this stage we want quality breast milk. Mom's diet affects the babies and the type of milk that they get in the NICU.
And doctor, does stress affect reproductive health and pregnancy?
Oh, yes, it does. It does. In terms of the reproductive health, if one has got high stress levels, then actually lead to hormonal imbalances and also could disrupt also ovulation. So now we've got some few techniques to try and avoid that. Things like the yoga, the meditation, and also one can actually be mindful of the stress levels and also good quality sleep in terms of reproductive levels and then reproductive health. And then in terms of the pregnancy, then that's when now we can have people going to preterm deliveries, low birth weight. That's when now Sister Nadia's unit come in at Netcare. They're quite good with that.
We're excellent.
They're excellent. They've actually got this well equipped and well staffing, and the doctors there, they're excellent. We also have the neonatologist there. The neonatologist is the doctor that actually specializes with the preterm babies. So that's where now they come in, into the picture. So it's quite important for that, and also other people can even have miscarriages because of the stress levels. So it is very, very important for one to be mindful of their state of mind.
So Nadia, if you may elaborate, does your team handle emotional and mental challenges for the woman during pregnancy, like postpartum?
Absolutely, Shabnam. At Netcare St. Anne's, I must say we're blessed with such a team that is so highly skilled and passionate about what we do for moms and babies. So some of the important qualities that we have to have as healthcare professionals working in the maternity and the neonatal ICU is that the minute the mom books to have a baby with us, we start a journey with her. And we are able to interview her and immediately at the beginning identify if the mom is suffering with anxiety or depression, or she's just got a common general low morale about herself. Once we recognize those things, we then advocate for her. And that's where Dr. Liphapang and his team come in. And we tell them, doctor, we identifying such and such going on with this mom. Maybe we should, or we recommend that he refers to the psychologist. Or they themselves, they would have seen the mom for antenatal visits in their rooms as well, and picked up these early warning signs. Our team then has to provide support, hold the mom's hand if we have to, listen to them, provide a safe space, and create an environment where they feel safe to tell us what's going on. And of course, with the common goal in hand that we want a healthy mom and a healthy baby.
Of course. And doctor, speaking about early signs, can you tell our listeners what are the early signs of pregnancy that women should watch for?
Okay. Just one more thing. I think just on Sister Nadia's, before I come into
Yes.
my question, they also have the weekly
Antenatal
classes. That's where now, sometimes some of the patients, they're not open to us. They're not open much in terms of with interviews and everything with us. But when they get into those classes, that's when now some of the things get picked up. And then now they always get back to us to notify us. The patient X has got 1, 2, 3. Please look out for this and that and that.
I thoroughly enjoyed going through my time of pregnancy because you went for your 3D, I think there's 4D, and it's so nice to see the growth of your baby prior to birth. So it's actually a great feeling for a mom.
And they also offer the 3D, 4D ultrasound at around 28 weeks.
And how important is prenatal care?
Oh, just okay. Let me go back also to that question about the early signs.
Yes.
Of in pregnancy. So the first thing, especially if one has got regular menstrual periods, then the first sign would be one missing her period. The moment one misses the periods, then they should, if they've got regular menstrual cycles, they need to go back and check to do the pregnancy test. And then the other thing that could be there would be morning sickness. So they said it's morning sickness mainly because in most cases we'll find that one is having this nausea, vomiting, especially in the morning. The breast changes. That's when now the breast, they become a little bit heavy. Sometimes they become painful. And then sometimes the areola, which is this part around the nipple, it actually becomes darker. Then one can say, now it looks like something here. Fatigue. There is also some unexplained fatigue that most mothers actually experience. Frequency in terms of frequent urination. Others would tell you about the constipation because now of the reduced, because of the high progesterone level, then there could be a delayed defecations at the one going to the toilet and frequent urination. So those are some of the signs in terms of pregnancy.
Okay.
And then also cravings. Cravings, there also is.
Keeping you plugged on reproductive health and pregnancy advice, we have Dr. Liphapang and Sister Nadia Syed on the PMB Pulse show with myself, Shubnum, Ismail. So let's step out for a quick advert and come back. We'll dive into more fertility tips. So stay tuned. Fertility tips. So stay tuned.
24/7. 365.
Wow. Quranic program brings to you an opportunity for the next few weeks to understand our short surahs that are read in our daily salah. Our respected ulama will recite, translate, and give us an explanation. Don't miss this opportunity coming through Radio Al Ansar, Sundays at 8 p.m. Peter on Fridays at 10 p.m. Radio Al Ansar, keeping on and educated.
Reproductive deal to margarita pizzas plus one topping each for $1.99. Or go big or go home. The people let's my duo deal. Some pizzas for $2.69. Pure flavor perfection. And that's not all. The snack box combos are here. Your pizza boys' favorite pack to the ultimate money bomb to get our daily specials. Delicious, quick, Pizza Boys taste that hits different. Pizza Boys, bring your father to your slice life. Find your nearest Pizza Boys near you. Pizza Boys.
Ramadan is around the corner and preparation starts now. Get ready for a blessed month with Ramadan special at the Al Ansar shop. From premium quality dates, refreshing Zamzam water to beautiful Ramadan gifting ideas for family, friends, and loved ones. Al Ansar shop has everything you to welcome the holy month. Perfect for iftar and meaningful discount. Al Ansar shop today and prepare for Ramadan the right way. Call 03101 or visit us at 207 West Road, preparing hearts and homes for Ramadan.
Get ready, beam thumbs up with the gardening and natural living show you didn't know you needed. I'm your host and life coach, Rabia Carvalho, and we're talking birds, bees, butterflies, and blooms, growing food, home-based holistic healing, and much more. Whether you're a seasoned gardener or nature lover, planters, and professional, we got you. Let us bring you the ideas, the facts, support, and inspiration to go green wherever you are. Sundays 9 to 10 a.m. only on Radio Al Ansar.
Radio Al Ansar. Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor will be held responsible for any ill health caused by the advice.
You're listening to live Radio Al Peter Maritzburg, 105.6 FM.
Under the stars, I raise my hands in prayer. It's falling, carrying my in place. Oh, Allah, grant me strength to bear. Inshallah, I'll meet again. In the with no end. Your smile and laughter echo deep within. Though we're apart, you can count on me, my.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
Rahmatullahi, welcome wonderful listener, Radio Al Ansar 90 in Pietermaritzburg 105.6 FM. I'm Shubnum Ismail on back into conversation on reproductive and gynae health, review expert insights and valuable information on women's wellness. Stay tuned with us as we continue to explore this very important topic. So we have two guests with us in studio. We got Sister Nadia, Syed, and we have Dr. Liphapang with us. So Doctor, can you tell us what are the common complications during pregnancy and how can they be managed?
Okay. The most common ones would be preeclampsia, whereby there is a development of hypertension in pregnancy after 20 weeks. That's the most common one because now it also has a lot of complications. So now, in order for us to in terms of the management of hypertension, and also keep monitoring, you can also do some bloods, urine to check maybe any and target organ damage, and also we can also have gestational diabetes that is also common. This means that whereby the diabetes develops solely because of hypertension. This usually happens in the second trimester, that is after 14 weeks. We can also have with diabetes, gestational diabetes, we usually start maybe get involvement of the dietitian to advise on dietary diet, and then if still that one it fails to control, then we can start on some medication, and then keep a close eye on the baby and also on the mother. Because now some of the complications with the baby can have macroscopic, by the baby is very big. The mother, we have actually delivered a baby that was about 4.9 kilograms because of diabetes. Others would have hypohidramnios, whereby there is excess water, the water covering the baby, the excess liquor. So those are even at times fetal demise. So optimal that we try and manage the mother, the preterm labor. That's when now the screening is important to screen to see the mothers that are at risk of having that, and also the most common things also that are there would be infections. The infections, UTIs, the vaginal infections, those are also, it's mandatory for us to treat those because the mothers can actually also have preterm labor because of such. So those are the most common things.
Nadia, you guys are in the field of medicine where you're giving the gift of life. Alhamdulillah, what a beautiful facility environment. With the high-risk patients, what advice would you have for those expectant mothers if they are diagnosed with a situation to say there could be a situation where you probably could go into early pregnancy?
Shubnum, that's an excellent question. By the time the moms come to us, they've already been made a high risk and their complication. So our role is to make them calm down and say, hang on, mom, just breathe, relax. It's going to be okay. And I think there's so much of meaning. That sentence alone holds so much of meaning for this mother. We want them to trust us as a team. So the first thing they should do is put their trust in us and put their trust in their doctor to make sure that we are following a plan that is tailor-made for their specific unique high risk. And there's various, as doctor had already mentioned, various different types. it's our role to make sure that they're following that plan. So if the dietitian sets out a special diet regime for them, we have to make sure they're following that and we're encouraging them to follow it. If their doctor puts them on a exercise program, we have to make sure that they are following that exercise program, and our role in that unit is to support them through it. And one of the things that Doctor had mentioned earlier is our antenatal classes that we provide for moms for 5 consecutive weeks. These are some of the topics that we touch on and elaborate more and provide them with the knowledge that they may need. Stay more to the mom. So ask, what am I doing? Why are we doing this? What's next in the stage of my pregnancy? And I think the most important thing also for them to remember and for us to educate them on is to take it one day at a time. No pregnancy is like the other. Everyone is different from the next, and their journey is different from the next. So take it one day at a time.
So, listeners, one day at a time from the experts. Doctor, can you tell our listeners, how does maternal age impact pregnancy risk, and how can the woman prepare their body with such pregnancies?
On this, we've got two groups. We've got the younger ones, that is less than 20 years of age. We've got the older ones, those are the ones that is over the age of 35. So I'll start with the younger mothers. There is a higher risk of complications in that group. And there's also a higher risk of developing preeclampsia. There's a risk of developing gestational diabetes. There's the risk of eclampsia, which is actually whereby it's fitting due to pregnancy. And what puts them more at a risk is because some of them, they conceal the pregnancies. They don't attend the clinics, because the moment they attend the clinics, then it means that people will see them that they are pregnant. So that is the main thing. And another issue would be the diet, the diet, because now, the young ones, they don't eat healthy, that is the mothers over the age of 35 and above. There is a risk of abnormalities. Risk of abnormalities, things like the Down syndrome, quite common, over the age of 35. Another issue would be because of the egg quality, then there is a higher risk of miscarriages. There is a higher risk also of preterm birth and preterm deliveries, with main things affecting both age groups.
And what options are available for addressing morning sickness?
We can have, that's why now we look at, we've got medications that one can take. And another thing would be one to relax and avoid triggers, because one would say the moment I smell this or this, then those are some of the triggers that we need to avoid. And also things like ginger, they actually take that. It actually, and also they sleep, good sleep, relaxation, and also some medication for to try and manage that when it happens.
So, Nadia, I know you spoke about it earlier, but if you can just elaborate how important it is for breastfeeding and the impact on the maternal health and the infant health. I've heard that also combats disease management. So, can you just tell us a little bit about that?
Shubnum, I don't think anyone can speak enough about breastfeeding. I think we need a whole year maybe to explore the benefits of breastfeeding. Some of the key important things for the baby is it boosts immunity and gut health. So it reduces the baby's rate of getting infection and getting allergies early on. And it provides sort of like a protection against the gut from having anything impermeated. That's how rich breast milk is. It's also for optimal nutrition for brain development and overall growth. So this baby's brain, in just getting breast milk, is getting the optimal care it could possibly get. It lowers the risk of respiratory issues and diarrhea. So we will see a lower rate of NICU admissions if we start off on the right footing with providing this baby with the nourishment of breast milk. It helps with digestion and reduces the risk of persistent infant syndrome, because the composition of breast milk is so easily digestible for these newborns. The risk of it sitting on their chest or them having indigestion from it is very low. So yes, the baby will benefit immensely. Not only does the baby benefit from the breast milk, it's also the moms that benefit as well. It helps the uterus to return to the pre-pregnancy state. So putting that baby onto that breast within that first hour post-delivery is key in ensuring that the uterus contracts properly. It reduces the risk of breast and ovarian cancer. So it sort of regulates your hormones. It puts your body back into the state, resets your functionality, I could say, which greatly reduces the risk of ovarian cancer. It also lowers the risk of postpartum depression. So just picture the beautiful image of a mom sitting and her baby breast and breastfeeding. It creates automatic oxytocin. So these are the feel good hormones. Love her baby, and therefore we reduce the risk of having postpartum up in breastfeeding, because remember her body has to now produce more breast milk as per the needs of the infant, and that really helps her to lose weight as well. And most importantly, I think it is cost effective. I mean, have you guys seen the price of formula on the market? Really, it really is cost effective. And that's just a few I can speak about. I could go on about.
Inshallah, you have healthy pregnancies. Alhamdulillah, listeners, we're going to pause for a beautiful nasheed break. So let the soothing moment remind us of peace and balance we seek in both faith and health. Inshallah, the melody will refresh your spirit before we dive back into our discussion of health and pregnancy. Stay with us and we'll be right back.
To a live broadcast from Radio Al Ansar, Peter Maritzburg, 105.6 FM.
Life is spinning out of control. I leave my trust in you. He don't need me to worship, but I feel so out of place if I haven't honored my Lord at least 5 times a day. In the name of Allah, I will worship. In the name of Allah, we are free. That's all you ask me. My Allah is here with me. With the last words I breathe. River to the ocean, can never turn back. I traveled a lifetime back, but the world was out of focus. He brought me back, I'm finally on track. He don't need me to worship, but I feel so out of place if I haven't honored my Lord at least 5 times a day. In the name of Allah, I will worship. In the name of Allah, we are free. Now I finally know my purpose. That's all I tell you. My Allah is here with me. With the last words I breathe. In the name of Allah, I will worship. In the name of Allah, we are free. Now I finally know my purpose. That's all you ask of me. In the name of Allah, I will worship. In the name of Allah, we are free. Now I finally know my purpose. stars are in my hands, tears falling, carrying my despair. Your memories linger, they fill my heart with haze. You never reach out in every vacant place. Oh, Allah, grant the angels look over you.
You're listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Ansar 90.4 and Pietermaritzburg 105.6 FM with myself, Shubnum Ismail, and you are on the Pulse Show. Alhamdulillah, we have two experts with us. We are reconnecting with them. If you just joined us, it is Dr. Liphapang, a gynecologist in the city, as well as Nadia, Syed, a sister who's had great years of experience in the maternity sector. So we're going to drive straight back into conversation. And the next last bit of our conversation touches on infertility, cystic ovarian syndrome, also known as PCOS. So we hear a lot about this happening across with challenges with being common with women unable to conceive. So doctor, can you tell us how is this diagnosed and what are the symptoms and how can this affect fertility?
Okay. PCOS, as you've just said, polycystic ovarian syndrome. This is a common hormonal disorder that affects women of reproductive age. So now the diagnosis is a little bit tricky because now it will include history, it will include examination, the blood tests, and also imaging in terms of the ultrasound. And so now, in terms of the history, that's when now one would actually say, maybe I've had a sudden change in terms of the weight, whereby I've had just a weight gain. And another issue would be look at also at the family history, diabetes, family history of polycystic ovarian syndrome, family history whereby, because as I said, it's a little bit tricky if anyone has had issues in terms of conceiving. So now, and also we start looking at things like an acne. A lot of women will have a lot of acne, especially on the face. They'll have acne, there will be irregular menstrual cycles. Other people have regular, others who might not even see their periods. So it can go either way. And also weight gain, excessive weight gain, people with insulin resistance. So now these are the women that later on, they're most likely going to develop diabetes. So they're most likely to develop diabetes. So yes, so those are the means when now also when you go into a physical examination, that's where you can look out for acne, you can look for abnormal hair, and then especially that what we call the pattern, the male hair distribution pattern, so which is called hirsutism. And then now we can do the hormones in terms of the blood, and then we can do the ultrasound. When you do the ultrasound, I will see the ovaries enlarged and also with some polycystic things inside, which is just fluid-filled vesicles inside the ovaries. In terms of the fertility, the main issue would be because now we're going to have cycles. So anovulation, it means that you are not ovulating. It's simple as that. Because now remember, for one to fall pregnant, you will need to ovulate. The moment you ovulate, then you will have the egg, the ovum, leaving the ovary, going into the fallopian tube. That's now the fertility takes place. But then now that process whereby there is ovulation, it actually is actually being cut off because now there is this imbalance in terms of the hormones. So that is the main thing now, anovulation, and also because most people also have these cycles that are not going well. The periods are irregular. So those are the main things. They can have, those are the main things in terms of that. And then in terms terms of when they fall pregnant, the main issues that you might have is the main thing would be people miscarrying, because of this because of hormones that are not well balanced. So it's quite important for one to also look at to lose weight, because most people will find that even if the moment that they lose weight, then they naturally fall pregnant without any intervention. So it's quite important.
And Dr. There's been tremendous upgrades with advancements in medicine. We've seen AI introduced into medicine as well. When it comes to fertility, what are some of the advancements for treating infertility for PCOS?
Yeah, the main thing that they do now would be IVF, and also, but there is some things that are done whereby now you start having this. You look at the weight, try to lose weight and all those kind of things. There's also these AI things now that are all onto that have come in, that has crept in, that are actually assist in terms of the management of that. Yes, but then ultimately, IVF. Although with the IVF, there is no guarantee saying that other people will do the IVF and then it is unsuccessful. Maybe they fall pregnant on the second.
Advice will you give couples that are going through infertility?
The most important thing is support. That's one thing that I've seen. It works a lot. The support as couples, they need to support one another. They must know that the moment we start this journey, this is not journey or my journey. This is our journey. So we start this journey together, and also the external support from the family, from the friends, because now this thing of blaming one another is what we've seen the most. I've had a patient whereby they came in, and then the husband was blaming the wife that this is your fault, you're not having children. Then I said, okay, let us do the semen analysis, only to find out better if now we've got low sperm count or something like that. So now, if you walk this journey together as a couple, and also with that family support, I've also sometimes referred some of the couples that are struggling. They say they've got to go through the IVF. I've always referred them to some of the couples that have gone through the IVF, because I've always told them that this is a strenuous exercise. It's a kind of exercise that needs one to know, why do I have to do this? And also, it's going to be, then it doesn't work, you try this, it doesn't work, you have lost a lot of money, and then you start blaming one another. So to have people that have gone through this actually makes people, at least even if it's quite difficult, to try and manage, and then to know that this is why we are actually going through this.
Listeners, you're not alone. Always seek expert advice. Dr. Liphapang and Sister Nadia, it's been wonderful having you on PMB Pulse show. Are there any final words to our listeners? We'll start off with you, Nadia.
Okay, Shubnum, so my parting words would be to a few people. So firstly, for the young teenage group that are now finding themselves more and more sexually active, I want to tell you that pregnancy is not easy. Think first, protect yourself, and participate responsibly. That would be my advice to you. And then the childbearing age. You need to manage your pregnancies. So go out there, see your doctors, follow their antenatal advice, come to Netcare St. Anne's Hospital. We have free antenatal classes. Attend your classes and follow the plans that your doctors and your healthcare providers have set out for you. Then the moms that are struggling with fertility and those that are advanced maternal age, so greater than the age of 35 years old, know what your risks are and go into it mindfully, knowing how you're going to manage these pregnancies, because every pregnancy is beautiful and it deserves to be nurtured in a way that you know you're going to have a healthy pregnancy and you're going to have a beautiful baby. And lastly, my advice would be to, with our holy month of Ramadan coming up around the corner, and those mummies who still intend to fast, our Islam is so beautiful in the sense that it protects your health first. It prioritizes your health. So if you feel that you're healthy enough and you're well enough in your diet, your exercise, your resting, your lifestyle, and you are able to keep your fast, do so, and do so responsibly. However, if you feel that your health is at any kind of risk, seek medical advice and follow that plan. And last but not least, to the fathers out there as well, being Valentine's Day today, you guys play a huge role in supporting pregnancies. A woman is not alone. Take care of yourself as well as gentlemen, because as you heard Doctor touch on the importance of sperm health as well, we need you also in this journey for the outcome to be great for all of us. And Shubnum, Jazakallah so much for having me on the show, and well done to you for always using every opportunity that comes your way to make a difference.
Thank you, Sister Nadia. Doctor, any final words from your end?
I would like to wish everyone listening and everyone watching live stream a happy Valentine's, and then we must actually make this month of love count. We must not try, and we need to try and not miss this opportunity of love for love, and then we need to love our families, love our partners, be there for our partners, be supportive, be there for our family, be there for our children, and then coming also to the mothers. Please let us do the pap smears. They are scared of doing pap smears. Please let us do the pap smears. It's actually not nice, let me put it that way, to see a mother coming through with cancer and then they want to have hysterectomies. You tell them that no, it cannot be done, go for oncology. It just takes about less than 5 minutes to do this procedure. Please, guys, let us be serious about our health, and then let us support our wives to the fathers, and then also to the teenagers. This thing of sex is not going away. It's not running anywhere. So it's not. It's actually, let us not rush. Sex is something that is sacred, and therefore it needs to be done at the right time with the right person. Let us not rush into this, because now we get HIV from this, we get STIs, multiple STIs. Other people, they actually even get infertility because of the STIs. STIs can also, that damages also the fallopian tubes. Be careful, let us take care of ourselves, and then let us look after our health. Thank you very much.
Thank you for sharing your expertise with us today, and don't forget to love yourself. Your insights on pregnancy and reproductive health have been incredibly informative and helpful. To our listeners, we hope you found today's conversation enlightening, empowering. All the best for your Ramadan preparations. Remember, a healthy lifestyle is just the beginning of a healthier and happier you. Enjoy your weekend, and alhamdulillah, we have reached the end of today's Jazakallah for patience, and to our technicians, both Durban and Peter, for plugging us in. So that's a wrap from me, Shubnum Ismail, on the Peter Marisburg Pulse Show. Jazakallah, and have a beautiful weekend. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Live from Maritzburg, 105.6 FM. Radio Al Ansar, 24/7, 365.